common question patients have regarding rotator cuff tears and rotator cuff tear repair surgery is, can you wait too long to have rotator cuff repair surgery? Meaning, I know I have a tear, I've gotten some sort of imaging and I've been told by a physician that, I have a tear in my rotator cuff. And I'm not quite sure yet if I want to have an operation to fix this. Am I doing more damage, or am I creating a problem that can't be solved later on down the road, right? And the answer to that is sometimes, right? Sometimes. It's not always. It depends on the tear, right? It depends on the tear. And what we know is that smaller tears, 1 centimeter, minimal retraction, those can be watched and waited upon with minimal cost, right? Minimal cost of waiting. Larger tears, 2-3 centimeters, involving certain parts of the rotator cuff, like the rotator, it's called the cable, we call the rotator cable. Ones with retraction, where it's think of the rotator cuff like an accordion. If the accordion is shortened, I tell every patient, if your accordion is shortened, we've got a clock that's ticking, because the longer your accordion stays short, the harder it's going to be for me to bring it back out. And there's a certain point in time where the accordion stays short permanently, okay? So the answer to the question is sometimes. You want to have your rotator cuff tear be analyzed by someone who does a lot of shoulder surgery, right? Who specializes in shoulder surgery, or it's a huge part of their practice, because these are very nuanced things, right? Sometimes I see patients say, well, a surgeon, they felt like they were pushed into surgery, and I told them, you don't have to have you never have to have the operation, but there's minimal downsides to waiting, right? And then you see the opposite, where they had a relatively large tear where there were some downsides and they weren't given enough counseling on that. So it is a nuanced conversation. It needs to be evaluated by someone who does a lot of these, because there's not one cookie cutter answer to everyone that has a rotator cuff tear. I tell all patients these things are snowflakes, right? They're all unique. Every human being is unique. So there is some consequence to waiting. And the patients that have the smaller tear, that maybe have some pain, but they're kind of on the fence with surgery, I tell them, listen, as long as you're kind of staying like this, then leave it alone. But if you get a big increase in pain, or more importantly, weakness in your shoulder, then you need to have that re-imaged, because that small tear will eventually grow into a bigger tear. We just don't know when. It can take a couple months, it can take a couple years, right? Because it started off with nothing and then it got bigger. It's just doing this, it's just tearing more. So you need to be careful with that. And there's a point in time where you say, it's so big, we have to do something. Now, if you have that big tear and you don't do something, you get irreversible fatty atrophy, which means the muscle of the rotator cuff, the muscles in here, undergo these permanent changes that it doesn't matter what you do, it's gone, right? So you want to avoid that, and you need to make sure that you're putting your shoulder in the hands of someone who understands how to prevent that from happening, but also at the same time, not feel like you're being forced or told that you need to have something done in your shoulder because someone's just trying to do more surgery, right? So it's a nuanced conversation that we have every day, many times, because this is what we specialize in. But yeah, there are costs to waiting on some of them. So you want to make sure you have it evaluated by a specialist.